All right, good morning, everybody. Welcome. It's early, but it's a good day. I wanted to start off today with a quick story. I wanted to start off a story with a story about these two guys in New York who are working to disrupt healthcare. Their names are Mike Galbo and Russ Graney, and they started a small company called Aiden. I like this story because it's a story about personal experiences. Both Mike and Russ had a very similar personal experience separately, where they both had family members that went into hospitals for procedures, and both of their family members were required to go into post-acute care facilities after those treatments. Now, on discharge, the discharge planners at the hospital handed Mike and handed Russ a photocopied sheet of paper with 30 post-acute care facilities listed on them, their addresses and their phone numbers, and they said, just pick one of these and have at it. Now, Mike and Russ did, at that moment, what any rational human or individual would do, which is to pick the facility in the absence of any other information that was closest to their home. They're going to spend time going back and forth. Obviously, they want to pick something that's convenient. It turns out that that is not a great piece of information to select a post-acute care facility on. There are actually reams of data out there about the quality of these facilities, about issues that some of them have had, but it just wasn't readily available, and they didn't know about it. And it turned out that both of them had, separately and simultaneously, issues with their family members and the care that they were given. Now, thankfully, nothing serious or long-lasting happened. But what they realized when they found out that this data was available and out there, that they could create a site, they could create a resource both for caregivers and for discharge planners that would help people make selections on post-acute care facilities with much better data and much more reasonable data. Now, here's the best part, at least for me. Before starting this company, neither Mike nor Russ had any experience whatsoever with healthcare or the healthcare industry beyond their personal experiences of being patients. And this is a trend that I've personally been fascinated by for a long time. I think that the people who have the potential to disrupt industries tend to be people who are sort of outsiders, people who don't know much about it. Look at Jeff Bezos and Amazon. He didn't know anything about retail before he started Amazon. Nicholas Zenstrom and Janice Fries from Skype, they knew nothing about telecom, and yet they reshaped the telecom world. David Friedberg, who runs a company called the Climate Corporation, which was previously known as Weatherbill, if you talk to him, he'll tell you that if he knew things about the insurance industry that he knows now, when he went to start this company, he never would have started it. And that's what's interesting to me. These are the people that have the potential to disrupt this space. And the fact that it's happening in healthcare, a $2.8 trillion industry in this country, 18% of our GDP, is nothing but encouraging to me. Now, I have two titles at HHS, Chief Technology Officer, but my other title is Entrepreneur in Residence. And I tend to focus on that title more because one of the things that I've learned over the years is that technology is very rarely, if ever, a solution to problems. It can be a catalyst or an enabler or an accelerant. The things that solve problems are things that fold into that idea of being an entrepreneur, culture change, process change, all of that kind of stuff. And so in a nutshell, my role really is to help the leaders and the employees of the department improve on the way that we deliver on our mission of transforming health and healthcare and the delivery of human services for the American people. And we're looking for these disruptors. We're looking for disruptors both inside the organization and outside the organization. And it's necessary because at this point in time, and I think everybody here will agree with me, healthcare is undergoing its most dramatic transformation since the creation of Medicare and Medicaid in 1965. In January, as everybody here knows, affordable coverage will begin for all Americans. This is going to launch a new era in the insurance marketplace. This is coverage that 50 million Americans have gone without forever. Now, for 3 years, we've been preparing for this moment. This has all been set up by the passage of the Affordable Care Act in 2010. And I think in that preparation, it's safe to say that this world, this ecosystem, has been in a state of pretty dramatic flux. We're no longer living in a healthcare ecosystem where people won't have access to affordable quality care. We're no longer living in a healthcare system where more than 20% of your insurance premiums are going to go to administrative costs rather than the provision of care. We're no longer living in a healthcare ecosystem where preventative care, such as vaccinations or breast cancer screenings, etc., aren't an essential part of your overall health. But we are living in a healthcare system where data is fundamentally driving change. Data is changing how we interact with, how we experience, how we manage our healthcare. Data is fueling changes like payment reform, where we pay for the quality of care that we receive as opposed to the number of transactions, the number of procedures that we actually undergo. Data is changing how the average American is going to interact with their own health. It's basically changing it from something that only happens when we're sick to hopefully something that we pay attention to on a regular and daily basis. And then data is also changing how physicians actually provide care, from the integration of data from personal monitoring devices to the use of predictive analytics to help design the best treatment plan for an individual. In 2011, McKinsey put out a report that said that the value of data in healthcare was identified as having the potential to reduce literally billions of dollars of cost from the system, but also significantly increasing the quality of care. Now, we at the Department of Health and Human Services, we see this value. I think if any of you have been following what we've been doing over the past few years, you'd agree with that. It's clear. Health data is a big part of the future of what we're talking about here. But what are we doing about it? Well, for the last 3 years, we've basically made a cultivation of the health data ecosystem a huge priority at the department through something that we call the Health Data Initiative, or HDI. It's pretty simple. The idea of the Health Data Initiative is, first of all, to make data openly available. Secondly, to disseminate that data as far and widely as we can. And third, to continuously educate both internal and external stakeholders about the value of data in this ecosystem. The mission here is to basically improve health and healthcare and the delivery of human services by harnessing the power of data, by fostering a culture of innovation, and really helping to create innovative uses of this data in public sector institutions, private sector institutions, research groups, communities, etc. Now, for the last 3 years, we have focused primarily on liberating any and every data set we could possibly find across the department. We started with 30 data sets in 2010. Just recently, we passed the 1,000 data set threshold on healthdata.gov, which is a pretty interesting and cool milestone. And so because of this, I can report that I think we have successfully changed the default setting within HHS. From closed to open when it comes to the release of data. And I see this every day when I talk to people across the department. Let me give you a great example. Earlier this year, the Center for Medicare and Medicaid Services, CMS, released charge data for the most common inpatient and outpatient hospital procedures. And we got a huge response on the release of this data. In just the first couple of weeks that this data set was out there, it was downloaded over 200,000 times. And this is the thing that I think is pretty cool, it was actually even featured positively on The Daily Show. How often does Jon Stewart talk about government in a positive nature? I don't know. I don't know about you guys, but to me, we've made it, right? I mean, Jon Stewart said good things about government. But even better than that, and this is a little bit of inside baseball stuff, but I was talking to my boss, who's the Deputy Secretary of the Department of Health and Human Services, Bill Corr, about this statistic a couple of days later, and he looked me straight in the eye and he said, "Bryan, that's great, but what are we doing next?" And to me, think about that. The second in command at the Department of Health and Human Services wanted to know, he said, a couple of weeks had gone by, he said, "That's great, what is next? What data are we putting out there next?" He threw down the gauntlet. And look, we're never ones to run from an opportunity like that. So we picked it up and we're running with it. So here's what's next. Now, we've talked a lot about entrepreneurs and developers over the last few years, but it's not just entrepreneurs and developers who need access to data. Patients need data too. So we're working with many of our colleagues across the department to help liberate personal health data, primarily through something called Blue Button Plus. I can't see you, otherwise I would ask how many people have heard of this, but let's just assume that some of you have and some of you haven't. Now, Hipaa regulations were recently clarified to give patients the explicit right to an electronic copy of their data, and also through the Meaningful Use program that the Office of the National Coordinator for Health IT runs, this fall and this winter, patients across the country are going to be able to begin to view, download, and transmit this data in their provider's electronic health record. And there's a growing ecosystem of patient-facing applications that's just starting to emerge. This is a very nascent ecosystem, but it's just starting to emerge that helps patients collect this data, understand their data, and solve some of these priority problems. One of the things that we're going to focus on at the department is the idea of blowing out some of the specific use cases of this to prove the value. So some examples. Enabling patients to reconcile errors in their healthcare record. I'm sure we've all had the experience of looking at some of our data and recognizing that it was transcribed incorrectly, and the process for getting that changed is difficult, to say the least. So one of the things that we think is a very important use case is enabling patients to fix that problem. Secondly, I got a couple of kids. They go to camp and school. Vaccination records are a huge pain in the butt, right? Getting them from various doctors, giving them to various entities, et cetera. That's a great use case. It doesn't, cure cancer, but it actually helps almost everybody in this country who has kids that go to schools and camps and things like that do things in a better way. And then third, and I've had this experience on a number of occasions where your claims data is incorrect. The transactions that you're being billed for are wrong. Wouldn't it be great if we could help people understand their claims data, their EOBs, in a better way? So these are just a few examples. There are millions, literally millions more. And I think the ask here is that we need your help to blow this thing out of the water. Now, if this all sounds great, but you don't have any experience with Blue Button, don't worry. We're holding regular live and virtual developer forums and community meetings around the country, and we're working really hard to do what I think is really important, which is build a community around this idea. An example, this weekend, we're actually sponsoring a Codeathon at the Health 2.0 conference. The topic of this is Power to the Patient. And there are two tracks. One is to help patients understand claims and EOB data. This is something I just talked about, obviously. The second, I really like this one because I'm personally a quantified self nerd. It's basically to help patients use consumer devices and other patient-generated data to stay in better contact with their physician, to provide that data to their physician in a way that makes sense. So these are both excellent topics. They're both ripe for innovation. So if you find yourself in the Bay Area this weekend, go forth and code, go develop, go build something cool. And there are good prizes associated with this too. Now, we also want to make it easier for consumers to find and use their data. So this January, we're launching the Blue Button connector, which is going to make it very, very clear. It's a website. It's going to make it clear what type of data patients can access through their providers, but also highlight some consumer applications and tools that are enabled with Blue Button. So if you're already on your way to building something that is Blue Button enabled, or if you've already built something that is Blue Button enabled, let us know, because we want to make sure to include it on this site so that people understand what the ecosystem is like. Now, we're also working with the Center for Medicare and Medicaid Services to make data much more accessible and much easier to work with. Right now, for any of you who have tried to get access to CMS claims data will know the process for accessing it is a bit tricky. It's a little onerous. It's usually pretty expensive, and it typically results in an encrypted hard drive being shipped to your door. That's not really the best way of working with data. And so CMS is working on something big. I actually think this is a really, really big announcement that's going to come out next week to help solve some of these problems. Now, I've been sworn to secrecy. I can't tell you what this thing is. But my good friend and colleague, Niall Brennan, who runs the wonderfully named Office of Information Products and Data Analytics at CMS, a title only a government could come up with, is standing somewhere in this room. And this is Niall's baby. And Niall has been known to have a fondness for a rare microbrew. So if you see him after the conference, you might want to have a chat with him at a local watering hole. Just a pro tip for you. Now, another thing that we're working on is looking to pilot in 2014 the idea of taking CMS claims data and putting it into a data enclave that contains other sources of information. Working with claims data is one thing, but working with claims data combined with clinical data, combined with other sets of claims data, actually has the potential to really be transformative. And so we're looking at several data enclaves out there and looking for ways that we can put CMS data in there in a responsible way to get other people access to this massive set of information that they can do interesting things with. Next, we're working to encourage and enable the disruptors, the people like Mike and Russ out there, by helping them scale. One of the things that I learned when I was starting up my software companies is that one of the hardest things was getting the first customer, right? Getting somebody to take the plunge, getting somebody to take a leap of faith and saying, we'll try this untested piece of code and see what happens. That was always one of the hardest things. But what we found was that once you have that foothold, once you have one or two customers, it became a lot easier because you had real reference points, you had real people who could talk about your stuff. So what we want to do is work with care delivery networks, work with hospitals, and hopefully sign a couple of agreements with them to create what I'll call a pilot test bed for entrepreneurs and developers who are creating new applications working with health data. It's not easy for these companies to actually get this information or to get access to these systems. And so if we can help them do that, we can, I think, make a big difference. These are incredibly risk-adverse organizations. And so if we can reduce the risk a little bit, then I think it'll help greatly. Now, here's the thing. We know it's hard to get the players in this world to change. So we need your help in catalyzing the transformation and the disruption in the system. I've just mentioned a bunch of places that you can plug in, but in case you need some different ideas or an open invitation, here's a couple of examples. First, do you have a data set that we have that you want to work with? Let us know. We want help prioritizing our future data liberation efforts. A quick, great example. The 2012 results for the National Survey on Drug Use and Health were just published. It's the most comprehensive data set the department has on drug, alcohol, and tobacco use for the entire country. So we had a developer come and contact us and said, hey, I want to work with this data set. And so we said, all right, and we went and took a look at it. Now, it turns out that this data is technically open, but it's released in a big PDF, which, if you're a developer wanting to work with data, is a little less than useful. This is not necessarily uncommon, okay? But what we want to do is focus and prioritize our efforts because there is a lot of stuff out there that we could do. We want to make sure we do it on the right things. So we're calling this the strategically relevant data set issue. If any of you out there have ideas about data sets that you want to see have better access to, let us know. Those are the ones we'll prioritize. Second, it isn't just HHS data we're looking for. We're seeing growth outside of the Department of Health and Human Services, and recently we actually added data from the state of New York. We have a bunch of New York State health data sets in healthdata.gov right now. And there are a couple others that I'm actually very excited about that we're working on. So if you have data that you think we should catalog at healthdata.gov, I would love for this to become the one-stop shop for health data across the ecosystem. So let us know about that. Finally, last point, we want to know what you all are working on. One of the things that's difficult for us is to get a comprehensive survey of what the world is doing out there with health data in innovative ways. So tell us. As you've noticed today, I've talked about a couple of entities on stage. I do this a lot. We like to talk about interesting and innovative uses of information and data and people who are transforming these industries. So tell us what you're doing and let us know. Now, just to close, my good friend Todd Park likes to say that there is no better time than right now to be an entrepreneur or developer, a disruptor in healthcare. And you know what? He's absolutely right. There are massive, massive piles of opportunity out there. We are just scratching the surface. Every day I see a new example of something that can and should be changed or disrupted. So guys, let's do this thing. Let's go. Thank you very much.